Here at the Draelos Metabolic Center, ultrasounds like these are done all the time to find thyroid disease or thyroid nodules. Now we're going to talk to Dr. Draelos and one of his patients about this and about the symptoms. They can be as simple as fatigue or high blood pressure.
Thyroid disease can be very common. Some surveys have shown as many as a quarter of the population may have what's called subclinical hypothyroidism. That's where their thyroid gland is not putting out enough thyroid hormone. And it's very subtle. They may not notice it. But it can contribute to fatigue, weight gain, high cholesterol, high blood pressure, and just overall not feeling well. If you have a constellation of those symptoms, or if you have constipation, unusual dry skin, more tired than usual, it's worthwhile to just have a simple blood test. And for an overactive thyroid, probably the most telling symptom, the one to pay most attention to would be a rapid heart, your heart racing rapidly. We do ultrasounds of the thyroid because another very common thyroid condition is what we call nodules of the thyroid. These are growths in the thyroid that are much more common in women than in men. And some surveys have shown as many as 50% of women, elderly women, have growths in their thyroid. Now, the reason we're interested in them is because about 5%, maybe a little bit more, can be cancerous.
I'm a sonographer. I do ultrasounds. And I was trying to work on my equipment 10 years ago when I was first new in the field. And the thyroid is the easiest thing to scan on yourself. And so I was scanning myself and found this solid mass with vascular blood flow, which is more indicative of cancer. And so, of course, I freaked myself out and, followed it up from there and got a bunch of testing. But even at that point, it was so small that the endocrinologist couldn't feel it at that point. But it has grown significantly, and he said it was time to get a sample of it and figure out exactly what's going on, and it turned out benign. It's still there. It's not worth taking out at this point. But, if you follow something and watch it, and if you trust your doctor and follow what your doctor says, then, it should be fine.
And this is the normal thyroid. This is the trachea. This is the Adam's apple right here, okay? This is a normal average-sized thyroid gland. It has two lobes, right lobe, left lobe. Now, this is a thyroid gland with we call a solitary nodule. And that's about the size that we would begin to worry about cancer.
We've done an ultrasound in here and we've done a biopsy. And the biopsy, I was really surprised at how minimally painful it was.
People need to pay attention because thyroid cancer can be fatal. The former Supreme Court Justice Rehnquist died of thyroid cancer. So it's something that can be dealt with if we catch it early. It can be treated surgically, and then depending upon the size of it, a dose of radioactive iodine is given through swallowing a capsule. Okay, and that leads to a cure in the vast majority of thyroid cancers.
Let's see it.